this is the third season of our 4 seasons approach towards pelvic floor and pelvic health provider training. So this is the season on assessing and treating the anorectal triangle. And the first thing I want to advise is that you become ambidextrous as soon as possible. So I think we're all used to starting out our techniques, treating internal and external rectally on the same side with the same arm. So what I want you to do first is start thinking about practicing switching sides. When we look at the anorectal triangle, here we've got our tailbone, anococcygeal ligament, the rectal opening. So this is the EAS, perineal body. I want you to think about treating on the side down. You get that compression against the table to help that patient feel a little bit more comfortable. And then you can really try to be more specific about what muscles you're treating. These muscles are so integrated into one another. It's really not fair to say that we're isolating one over the other, but we can certainly be more intentional and be more specific. So you can see further down here, you've got the fibers of the coccygeus and the fibers of the iliococcygeus, and then you've got the obturator internus. So what I want you to start thinking about in your head is that specificity, being more specific, and that's where we advance you into dry needling techniques as well that are really safe with some level of a backdrop in the bones to kind of help us guide that approach and then apply neuromodulation. So what I want you to think about is here's EAS very specifically around the anal opening. So if you want to target that a little bit more, you're going to use 2 fingers, no nails, cut them, and you're going to be right on this EAS. If you want to be more specific to iliococcygeus, you can see here that you're going to drop and be a little bit below it, and you're going to aim on what is probably best guessed at the location of the patient's belly button. So you're going to aim this direction. If you want to be more specific to coccygeus, you're going to go towards the tailbone where you can see these fibers are starting to attach, and you're going to aim a little bit more specifically to the head of the patient. And that is going to help you slow down your anorectal assessment of the muscles. It's going to improve your palpation, and it's going to make what you're doing quite a bit more specific, and that's going to generate better results because it's going to give more input to the brain to help that reconnection happen, to get some therapeutic neuroscience going, especially if you educate at the same time that you're doing it. And it's also going to help you to really isolate and identify trigger points and start generating more oxygenation of those trigger points, improving blood perfusion in those trigger points, helping those shut down a little bit so you can activate better motor control patterns throughout the entire pelvic girdle. So that is our season of anorectal assessment and some tips on how to start advancing your techniques. Thank you.